don't use cleaning products to clean your stoma. You use just warm water. Okay, so what you need: the dry, sterile wipes that are lint-free, first of all, so you need those. Need a bag to put the dirty stoma bag into, dispose of it. This is the all-important, this is the adhesive spray. The sticky that holds these on is very sticky and it hurts to pull it off, so obviously so you don't leak, so you use special spray to take it off. You may notice around here that I've got extra bits of sticky. This is because I've got a convex stoma bag on, because my actual stoma is a little bit higher than they would usually be. It's actually within my crease, so when I bend on that side, my stoma itself, that's the bit of bowel that's sticking out of your stomach, that's actually called the stoma, is around about there. So of course when I bend like that, it bends in, which means obviously it can't empty. So use convex ones, and then because it's near my belly button, this won't stick properly, so I use these extra sticky pads to seal it around my belly button. So yeah, so this is a spray that I use to take it off. This, I don't really use it at home, but it's a spray that you can spray. It's a bit like VI poo, but it works a bit better. You spray it before you empty your bag, and you spray it afterwards. You can get sealed bags, you can get bags that you can wear for 24 hours, and you open them up at the bottom and you unfold them and you empty them in the bin. I'm not going to do that because that's too gross. Usually I would empty the bag, even though I'm taking it off, before I put it in the bin. But for the purposes of the video, I'm not going to do that because, you know, who wants to see that? So this is a fresh bag I'm putting on. So when I say it opens, that's the convex part. The bit that makes it convex is this bit that sticks out slightly. And that's just to give that a bit of security. And then these open. These are really good because they open. Why would it be opening? It would be opening that way. So these that sticks you that way. And then they open at the bottom here, and they're really hygienic, really strong Velcro. And you have to unfold them 4 times, and then here you have where the opening is, and your fingers go nowhere near the feces. So you hold this closed, you hold it over the toilet while it's attached to you, obviously, over the toilet, and then you pull this bit here, this opens, it's up that way, so everything comes out. If it's a bit thicker, sort of squish it out as much as you can. And then I usually have a glove as well. I personally sort of wipe as much as I can of this away in here. And obviously I clean the outside. And I also use, you get like hygiene wipes. And I clean the inside of this out with hygiene wipes. So that bit there in the tube there, that's totally clean after every time I empty it. And all around here. And even though no feces has gone on the outside, I also wipe that just because I'm uber paranoid about them smelling. And then again, you're wearing it like that, fold it up. Sorry, I'm not showing you very well. Fold it up and fold it up. And then you lift this here, that blue part there, there's your Velcro. That sticks on, that pulls over, and you can't see it. Now, all the bags have this lip here and here. I don't know if you can go, the light's not very good. I don't know if you can see in here. Can you see my finger there? That's where my stoma will be. So my stoma will be inside there. So these flaps are good because sometimes you want to just see how your flow is. You want to see if there's too much air in there. And because I'm new to having a colostomy, I do just like to make sure everything's okay. So I quite like the fact you can lift it up and see inside. if you need to, but it's sealed, so should your top lift up, no one's going to be subjected to looking at your poo. So I've got that there. I haven't actually got the phalanges with me, I don't think. I've got them in the bag. I should have them in the bag. I don't think I do. But hold on, I'll do a part 2 because I need to go and get the whole flange something or other stickers. 2 seconds, I'll go and get that and I'll be right back. Back for part 2. Hiya, I'm back now. Right, as I was saying, I need to have an extra sticky to stick it where my belly button is, because otherwise it's going to stick very well. And this is what goes on. You pull the backing off and then you stick it there and push it into place. Right, without further ado, let's go, because I want to go to bed. So I'm just going to put that down now because that's not in your way. I only use one glove just on my right hand because that's what does all the work. It's pointless wasting them if I don't need them in the hand. So first things first, you start with your spray. Now these stick pretty well, so I tend to give it a spray all round. And these ones from Salts. The Salts company are really good. They smell of peppermint, so that again, if you're out in public and it helps with masking any smells and things. Now I'm just going to make sure it's not too bad to look at when I take it off. Can you see there how it pulls on your skin, and that has had some adhesive remover on it. So when it starts pulling, that's when I just give it a bit more of a spray. Okay, right, there's no faeces around my actual stoma, but the stoma does stick out and it is pink, so just so you know. Right, okay, here we go. So then I fold that up, which again helps mask some of the smell. A good tip when you're doing your bags up as well, and the same goes for if you use something like this for your baby's nappies, don't be tempted to use the handles and tighten a couple of knots because the scent will escape. You get as much air out of the bag as you can, and just twist it like that. And then you can sort of control pulling that knot down as close as you can get. Now with that, no air is going to escape, whereas when you tighten a knot with the handles, air, trust me, does come out. So pop that in the bin. So now there is Tina. That's her name, Tina Turner. So with these lint-free soft wipes, just put them in warm water, squeeze the excess off, and what I do when I've first taken it off is I usually just hold it over for a bit, just to give a little bit of a... I have baths with the Stoma bag on, and then and everything, because you don't want like strong fragrances and perfumes like shampoos, body shower gels and things to go actually on your stoma. So what I tend to do is I'll have my bath, and what I'll do is I'll get in the bath I'll quickly take my bag off and let her have a little bit of just a soak and everything, and then I'll get past all my stoma gear, put it on, and then get in the bath to do my hand washing, hair washing and everything. So you be gentle, don't rub very hard. I've done this wrong. Usually you keep your bag to put these in, because I was doing a video, I got all confused. And it's literally like wiping your bottom. You want to make sure that anything that's on the outside there is lifted off. There we go. I have to use another bag, which I really don't like to do, but I've been silly and done the other bag up. There we go. Now, okay, the sticky is that strong, it still sticks to you. And the best way to get that off without using too much of the spray, and the best way I found, there's no point spraying it all on and wiping it. You use too much spray. So I use one of those soft cloths, 3 or 4 pumps, and then where the stick is worse, I just hold it on and then gently drag. So I'm going into my belly button there, because obviously sticky gets in there, and you know your belly button's like, yeah, all knotted and things. So I don't want a build up of any sealant on there. Now, this is difficult because I usually have a mirror that I do this in. A couple of reasons. I'm pretty good at doing and putting everything on, but from this angle I can't see if she's about to go. But with a mirror in front of me I can. So there you go, that's it. The sticky, I think that bit there's a little bit there. Sticky is basically off. There's a little bit extra there, but not too concerned. Now, put the baby on. So I always make sure my bags are done up before I put them on, and then I just give that a squeeze so I know it's nice and tight. This little blue tab does what it obviously looks like it does and pulls off, and try and put it off all in one go. Now here is what sticks on, and notice there's not slits at the top bit there, because that usually sits at the top of your, that goes at the top of your stoma, but usually it is a little bit lower. Now you have to make sure that the hole is big enough to fit over the stoma, but not so big that there's any gaps, because that can cause leaking and it can cause sore and redness on your actual skin and make you, get poorly and make you very sore. You also need to make sure that it's not too small, that you're missing bits or that you're squeezing her in. You don't want her squeezed in, because that will cause you problems too. So that takes a little bit of figuring out, because she does change in size from the first time you get her to when she settles down, but she's sort of settled down now. She's sort of where she's going to be. Now I've been doing this for a while now, so I'm pretty good at getting it in the right place at the right time. There we go, so she's on. What I'll do is I'll lift this flap up in a minute so you can see where she is. And now what you do is you hold this sticky in place just for a bit, get a bit of warmth from your hands on it to help it to stick. And then I tend to just look at the top bit and just give it a little flick and see if it's stuck. If it's stuck there, it'll be stuck everywhere. Now it's this bit here, can you see where it delves into my belly button? That won't stay. It just won't. Even how sticky it is, with movement and sweat, and it just comes off. There's too much movement there for it. So this is where this comes in. And again, it's got a little pulley tab here. Now these aren't the ones I like using. These ones are quite thick. Can you see they're quite dense? You can't see my hand really through it too much. There are another brand. I'll show you 2 seconds. That I've run out of. That's the brand I use usually. I find them better. I find they stick better. They're better to mould around your belly button, because these are thicker. They tend to just want to just stick where you put them, whereas the thinner ones, they're a bit more malleable, you can mould them around. So I'll turn to the side. You get this, and you want to put it as close, because it's got the slits in on there. You want to make sure they're covered up, because if they do come unstuck on there, you could get a leakage. So I've got it where I want it there, so I'll rub it there. Nothing really to worry about down the bottom, so I can pat that down in place. And then this bit here, I'll hold it up, I'll tap it into my belly button, and I'll tap it up there. So it won't actually sit in a nice curve around the top bit there, because obviously it's having to come out a bit to my belly button. There we go. And that's how you put it on. And then if you want to see where she's in the bag, Tina is in there. And then at the top there, that's a filter. And that allows, because you still fart, but you fart from the bag, and you don't want the bag filling up with air. So the air escapes from there, but it has a filter in it, so it doesn't smell, so you never have stinky farts. But yeah, that's it in a nutshell. So that's your Stoma bag, that's it changed. And that's what it looks like from this side. And that's what it looks like from that side. This side of my belly sticks out a bit more because there's feces in my bowel and a lot of my bowel's up there. There we go. Thank you for watching. Hope it was helpful.